Hi, and welcome to iTenv Healthcare Solutions webinar. We're excited to present Automate Patient Credit Balances in NextGen. My name is Chelsea Grover, and I'm the Marketing and Communications Coordinator for iTenv. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention this webinar will be recorded, and that we'll send out a copy of the slides along with the recording within the next week. Now, as most of you know, this is usually when we cover a bit of who we are with you. But since I promised in the webinar invitation to make this one brief, we're just going to jump straight into it. I'm just going to take a quick second to remind everybody that tomorrow we're doing another webinar on maximizing maximizing NextGen's full potential, see how iTenv can help. And that's going to be another kind of a strange webinar in which we're going to do a complete overview of everything that iTenv has to offer. I know that most of you have some iTenv services already, so you might not know of all of them. So if you're interested in learning more about how we can help you maximize NextGen's full potential, feel free to drop me a note in the chat box and I'll get you registered for that. Okay, so moving back, because I promised not to waste anybody's time today, we're going to just get things started here. So quick poll. I'm going to give everybody 15 seconds to fill this one out. That's just a 2-question poll. So first one, what patient credit functions are you looking to optimize? Issuing refund checks to patients, to insurances, moving line item credit balances between charges and encounters, or managing balance control issues on the same charge? So I'll give everybody another 5 seconds to fill this one out, and we will close it in 5, 4, 3, 2, and 1. Okay, so we're going to close that. Thank you everybody who voted. Quickly, here's what the results look like. Looks like you're all pretty split between issuing refunds to patients, moving line item credit balances, and managing balance control issues. So we'll hide that one, launch the next one. We'll share this one. Last one. Looking to what unapplied balance functions are you looking to optimize? Resolving a backlog of unapplied credits, copays, prepays, etc., managing deposit money taken for future procedures, or managing unapplied dollars on a daily basis. So again, we're just going to give everybody 15 seconds to fill this one out. And again, thank you everybody for joining us today. We are doing this in a new format, trying to make it super quick so you can get back to your busy day, because that's why you're looking at an automation tool to begin with. Okay, so we'll close this one in 5, 4, 3, 2, and 1. Okay, so I'll share those in case anybody else is interested. Looks like nobody's having any trouble managing future money for future procedures, so way to go on that. So with that, I'm going to turn this over to the presenters for today. Tom Seco is iTenv's Business Development Manager and subject matter expert on the products, and Joel Schultz is Director of Product Solutions at iTenv, which means that he and his team are the people that actually build these powerful tools. So thus is going to be in a great position to demonstrate it. So Tom, it's all yours. Feel free to get started when you're ready.
Okay, thank you very much, Chelsea. So today's agenda, we're going to cover 2 areas related to the practice management side of NextGen, handling of credit balances on your patient accounts and the processing of unapplied balances. You'll gain an understanding of how you can do this more efficiently and effectively using our 2 add-on products, the Refund Manager and the Unapplied Deposit Manager software. At the end, we'll answer any questions that you have as well. For many years, we've been talking to our clients about credit balances, refunds, and unapplied money. And the common challenges that have been expressed to us during this time has been on the credit balance side, moving line item credits, issuing refunds to patients and insurances, and then managing balance control issues. On the unapplied side, the common challenges that have been mentioned to us has been resolving a backlog of unapplied credits, keeping up with applying the unapplied money on a regular basis, and then managing deposit money for upcoming procedures. The deposit money has been a more recent challenge that's been raised over the past couple of years, but we see it being mentioned more and more over this past couple of years, like I said. The percentages that you see here are the percentages of practices that we have begun to keep statistics on. And so this is the percentage of practices that have been mentioning these common challenges are their issues. So as you listen to the webinar today, think about what your challenges are. Are they one of the common challenges that are mentioned here, or are there some other type of challenge? And also think about the causes of those challenges as well. Maybe those causes are you maybe need a improve a process, or maybe it's you don't have enough time, or maybe you just don't have enough staff. But think about what your challenges are and think about what the causes of those challenges are as well. What I'm going to do now is just take you through a couple slides to so you can visually see how the product affects their respective process. And we'll start with the Unapplied Deposit Manager process. Typically, when processing unapplied balances, you need to go through a process of what I'll call finding, reviewing, and posting. You need to find the patient accounts that have the unapplied balances. They need to evaluate each unapplied balance and determine how you want to process it. And then you have to manually create the transaction to take the appropriate action that you want. When you're all done, then you go through a process of reviewing all of those transactions that have been created in the batch to make sure it is doing what you want it to do. And then you need to post the work once you get through that process. With the Unapplied Deposit Manager software, you can let it do all the upfront work for you by finding the unapplied balances based on the rules that you create, and it creates all the transactions for you. And that's identified by the gray boxes up here that you see underneath the find process. You maintain control of the review process, you maintain control of the posting process. So let the Unapplied Deposit Manager software do all the heavy lifting for you. On the Refund Manager side, let's take a quick look at that process. With the credits and refunds, you're going to either be reactive or proactive. Reactive meaning that you're going to have a patient that calls up and says, I have a credit on my account and I would like to have a refund issued to me. On the proactive side, on a daily basis, weekly basis, monthly basis, you go through and process a group of credits in your system. Either way, you're going to look at the encounter details, transaction details, account details, and you're going to decide what to do with that credit. You're going to either issue a refund or you're going to decide to apply that credit to an encounter that has an open balance on it. Once you get through with that process, you then bring that refund information, send it over to accounting, and accounting has to enter that information into the accounting system, print out the refund checks, and then on the back end, sometimes some organizations will update the account in NextGen with that printed check information. Sometimes the practices or health centers don't do that. With Refund Manager, it touches many points along that process, and that's indicated by the grayed out boxes here. So Refund Manager will, with the search mechanism and filters that we've created, makes it much easier for you to find the credit balances on the patient accounts, to take an action on that credit balance, whether to issue a refund or apply that credit to an encounter that has an open balance on it. It creates all of the transactions for you. Once you get through with that process, we move that information over to accounting, so accounting doesn't have to do the data entry part. They just have to import the file and make sure that there's check paper in the printer and the checks are printing out properly. And then on the back end, we automate that process of bringing the printed check information, check number, check date, check amount, and update the patient chart with that information. So we call it streamlining on the front end and automation on the back end. There's going to be 3 modules that you're going to see in the demonstration. The Credit Scout module is the one that enables you to find the credit balances through the various search mechanisms and filters, allows you to take an action on that credit balance. And then the Batch Detective module is the one that brings the refund information over into your accounting application. And then the Import module is the module that allows you to import the printed check information, check number, check date, check amount, and update that into the patient account in NextGen. So that's what you're going to see in a demonstration. The Unapplied Deposit Manager software works effectively by itself. The Refund Manager software works effectively by itself. But when the two are combined together, it provides you, an organization, a comprehensive credit processing solution. And this is enabled by the functionality within the Unapplied Deposit Manager software that allows you to create line item credits when appropriate, and then it can be processed by Refund Manager. So the two combined together can offer a very nice credit solution to your organization. So with that, I'm going to turn it over to Joe, and Joe's going to take you through the demonstration.
Great, thank you, Tom, and thank you everyone for joining us today. I'm going to take you through how this actually works in the real world, what the workflow looks like for these tools, how they fit together. And this is going to be a brief and quick demo of what these tools can do to help you manage credits, both for unapplied and line item credits. But what we're looking to do is give you a good feel for what these are like, what the productivity gains would be like. And then we'd want to do a one-on-one demo where we can do a deep dive into either one of these tools or both of these tools. So similar to the slides, I'm going to start with the handling of the unapplied credit balances using our Unapplied Deposit Manager. Then, as Tom showed you in the slides, I'll progress into Refund Manager and how it handles line item credits. And I'll actually have some credits that come out of unapplied, fall down to the encounters, and then get refunded out eventually too. So let's go ahead and launch this. The Unapplied Deposit Manager interface is really a tool for building simple or complex rules about how you'd like to process your unapplied credits for different scenarios. Some of the common scenarios we run into are listed up above. Copay cleanup, where you're looking for specific amounts. Basic cleanup, where you're looking every day to keep up with your unapplieds. Some practices, more and more we're seeing this with third-party systems, have payments coming in over Rosetta, and they're coming in ahead of the charges, so the money sits out there and unapplied, and someone has to go and drag it down to the charges. So we have rules to take that out of unapplied and put those in the charges. And then we're looking at deposit management scenarios too. All right. To explain how this works, how these rules work, is basically you're building sentences from left to right. We look at the encounter unapplied. If it equals specific amounts, then go ahead and apply it up to the unapplied amount. So each one of these is a drop-down list with one or more options in it, and you go ahead and build out the sentence. In fact, over here on the right is a summary of what it's going to do. Now for this one, where we're looking for specific amounts, we have a column for pop-ups where we can specify additional parameters, whether that's amounts, transaction codes, providers, locations, dates, good things like that, and those get integrated into your rules. Okay, so the simple one, if we're looking for specific amounts to clean up copays, we give it our copay amounts. And normally what would happen is the system would run overnight through a job kicked off by the BBP, and you'd come in the morning and you'd have batches to go ahead and review, prune, and post. All right, another scenario I mentioned that we run into is the basic cleanup. And this one, again, left to right, encounter unapplied equals the patient amount, apply it up to the patient amount. Now, if we want, we can take a scenario where the encounter unapplied is greater than the patient amount. In this one, we have choices, right? We can either apply it partially or we can over apply it and end up with a line item credit. It really depends on what your goal is, if you want to keep money on the encounter or if you want to move it up to the account, and I'll show you that in just a second here. So this next one is our less than the patient amount rule. And then any remaining amount, go ahead and move that up to the account. And then what we can do is come down here to some of our account unapplied rules, and it looks at the remaining amount on the account and says, go apply it to charges with balances due oldest moving forward. Okay, so that'll do that every night for you and keep those balances taken care of and out of unapplied. So again, there's lots of variations you can do. You may not want to move it up to the account. You may want to be more aggressive with it. You may have balances that sit out there in the account for a while that eventually you want to age down and refund, and that's kind of what this next rule does. Account unapplied, remaining amount, wait age, then create a new encounter and create a credit on that encounter, and we'll grab that in Refund Manager. I'll show you that in a bit and show you how it works. As I've mentioned, these rules normally get executed overnight in production, but while you're testing, of course, you don't want to wait overnight to see the results. So we can go ahead and run a small window here and see what the results are going to be. So I'm going to go ahead and save this, and then we'll execute this set of rules. And it's going to come up with a listing of all the transactions that it put into NextGen on your behalf. You didn't have to go create these transactions to move around these unapplied amounts. The beginning ones here are the encounter-based ones where we're either moving it from encounter unapplied to charges locally on that encounter, or it's money left over that we're then moving up to the account to use on other encounters. Again, based on the rules that you set up, dictate the action that it takes. I want to point out these last two for Lori and Stephanie. These are cases where it aged the money out and it created a encounter with the SIM that we set up for the refunds that we want to capture that have just aged out, so we want to send the money back to the patient. So we end up with a credit on those, and we'll see these appear again when we get to the Refund Manager portion of the demonstration here. If you want, you can save this to Excel so that you can compare it to NextGen while you're in your test phase. And take a look, and if you don't like the results, you can delete your batches and come in, tweak the rules, and repeat the process. We normally recommend installing this in test first for that reason, so that you can create different variations of the rules to come up with the actions that you need taken on your unapplieds. We mentioned earlier about the payments coming in via an interface from a third-party kiosk or tablet system. So again, we have, our encounter unapplied amounts, what we're going to do with those, apply them up to the patient amount or unapplied amount. And in this case, we're saying the scope of the encounters we're going to look at, limit the encounters to the specific transaction code for the money coming in from the kiosk. And again, we can click that pop-up button and specify one or more transaction codes from NextGen to go look at. Last, the deposit management is that piece that if you're taking money, and I know in the survey, I think no one clicked on that as an option, but just to let you know it's there in case you didn't understand what we were asking. But sometimes we take money for a specific future procedure in advance of that procedure, and we don't want to use the money for anything else that happens in the interim because it was a deposit for that procedure, and the patient will be like, well, what happened to the money I gave you? So we can set up a cross-reference for the money being put into unapplied and what specific services or service items it can be used for in the future. Quick example of that is these are transaction codes that are used to take in the money in NextGen. So we take it in using, for example, patient deposit fertility and put it into unapplied. And then we give it a name. So we just free texted fertility deposit. What'll happen is each night the system will run. It'll look for money that's been deposited. It'll also look for money that's already being tracked and say, where can I use that money? It'll come over here and find the matching tags, and it'll say, okay, I can use it on this specific SIM or any SIMs with this modality. So I can list out a whole bunch of SIMs individually, or I can use modalities and apply it that way. So again, we'd help you build this cross-reference in your test system to figure out the total workflow that makes sense for your practice. But it's really simply a matter of mapping deposit codes to specific SIMs that they can be used for in the future. So the Unapplied and Deposit Manager, this interface is really to build the rules. So you'd give it to a couple people who'd maintain those rules. The process would run overnight. You'd come in the next day and you'd have batches that you can go ahead and post in NextGen. I'm going to go ahead and post one of these because I want to go ahead and carry forward those unapplied amounts we aged down to the new encounters and made a credit that we want to get out of the system and send the money back to the patient in this scenario. So I'm going to take this batch here. Again, all this work was done on my behalf through the automation. So you'd come in and you'd just have the batches available. You can step through them. You can delete transactions you don't like. And as mentioned before, if you don't like the whole result, you can delete the whole batch, go back and tweak your rules. So I'm going to go ahead and post this one. And now we're going to have a couple encounters for Lori and Stephanie, and we'll look for these names in the Refund Manager too. All right, so that's the Unapplied and Deposit Manager side of the equation. The Refund Manager, as Tom mentioned, with that we use the tagline streamline and automate. The Refund Manager is really intended to be more of an interactive tool than a rules-based tool. Okay, the reason for this is if you're sending money out of the practice We want you to make sure that you truly want to do that. Now, the other good news is you don't have to just send money out of the practice with Refund Manager. In fact, as part of the workflow, we recommend that you look for what we call distributions first, where you can take money that's in a line item credit and use it elsewhere on other charges where money's owed. That could be on the same encounter or it could be on a different encounter. So there's various search criteria on top to target what you're looking for and help qualify what you're looking for. We have some research tools in here that mimic screens you'd normally use in NextGen for the research. But I went ahead and did a quick search for distribution candidates. So that means there's a credit somewhere and there's debits somewhere else. I'm going to pick a couple of these and go ahead and use those credits up. Now, what we're seeing here is the patient credit has credit balances, the payer does not. This part of the tool only affects patient credit balances because of all the complexity and rules around insurance money. So if the patient has a credit on a charge, you can go ahead and move that money to another charge should you desire instead of refunding it out. So these are all line item credits, right? The other tool was unapplied credits. These are line item credits. So what we're seeing is a list of guarantors who have these credits. If I go ahead and expand this down, we'll see we have the guarantor, we have the account, we have who owns the money, what buckets it's in really. In this case is going to be the guarantor, but for the refunds, it could be the insurances too. Maybe you are refunding back to the insurance in some cases instead of doing recoupment. We have the encounter with the credit on it, and we have the charge with the credit on it. We have screens in here to mimic the transaction screen on the encounter. We have the charge ledger that we can mimic in here and see what's going on. We also have screens to mimic the financial summary and account summary. So we're trying to give you a majority of the tools to do your research right here in Refund Manager so you don't have to pop back and forth between Refund Manager and NextGen. Now, we talked a little bit about we're going to refund and we're going to distribute money around. If for some reason you can't determine if you want to refund it here in Refund Manager, we also give you the option to task it into the work log for further research. But for our scenario here of showing the workflow, I'm going to go ahead and pick a couple of these that we're going to distribute. We're going to use the money internally instead of giving it away, right? We're going to use it to pay down balances that exist elsewhere on the account in the system. So instead of me going and finding those balances and creating the transactions, I'm going to let it do its default behavior, which is oldest to newest. So go find the oldest credits and the oldest debits and use up one or the other. You can also affect how you want that to apply. Like if you want it to go to a specific charge, there's a screen to do that. But for our workflow here, I'm going to go ahead and say, yeah, go ahead and process these distributions. It's going to show us the transactions it's going to create. On the left is where it's pulling the money from. On the right is where it's going to. I'm going to say, yeah, do this, and boom, those transactions were just created in a couple mouse clicks here. So that's the distribution side of the equation. Now I'm going to search for some good candidates for refunds. So I'm going to change my filtering. Again, in the in-depth demo, we'll go into this in a little more detail. And like I said, we have these tools out here so you can go ahead and do the research. For our case today, where I'm just showing you how the workflow is and how fast it is, I'm going to pick a bunch of these that we're going to go ahead and refund out. Some of them are credits to the payer. Some of them are credits to the patient, which would be the guarantor. Now, instead of me going and creating all these transactions again, I'm going to pick what I want it to do, in this case, refund. I'm going to say process, and it's going to create the 9 underlying refund transactions for us. Now I'm going to do one more thing. I want to pick up those 2 new ones that I did for the overpays. So I'm going to pick these 2, Stephanie and Lori, that we just did today. So I'm going to process these into the batch too. All right, so just like the Unapplied and Deposit Manager, the magic here is we're populating the batch in NextGen on your behalf. We've created so far 14 encounters just by clicking checkboxes and telling it to go ahead and process the items. I'm going to go ahead now and balance this out and post it. And then I'm going to show you how amazingly quick this is to get the money out to your accounting systems. We support about 16 different banks and accounting systems directly. And then we generate some generic file formats for other systems. And if it's a up and coming system, we can talk to you about creating an interface to that system and what would be the best strategy. What we're seeing more and more is people are uploading files to their banks and letting their banks print the checks. But again, we have a number of these financial systems that we support because once we have those refund transactions, we need to get a check back to the patient. So I'm going to go ahead and find our batch here. I've had this batch open for a little while, so I got to go back and search for it. I'm going to go ahead and say, yeah, export that out to the financial system. The accounting people love this because they get out of the data entry business. We either create a file or talk directly to the accounting system and push the demographic and payment information, and even in many cases, GL mapping right into the accounting system so that you don't have to worry about it anymore. So now if I go into QuickBooks, put on my accounting hat here, I have some checks that are queued up and ready to print. So I'm going to say, yeah, let's go ahead and print them. I didn't have to do all that data entry. I can just do a quick review, run some reports, print our checks. And now to kind of close out the cycle, we'll see we have check numbers in here. So we want to get that check information back into NextGen so that you can track it in NextGen too. And again, this is just as easy as sending them out. I'm going to go find my exports that I've done and import them back in. So I was able to update from our 8 checks, all 11 transactions that were in NextGen. We allowed the system to send a single check to people who had multiple refunds so that we're not sending them, several checks. They're getting like one every day in the mail, that kind of thing. And here's what it looked like in NextGen. All that stuff that was happening on our behalf. Let me take you into one of these encounters. I'm going to take Jennifer here, 1207. Okay, when we created the refund, it created a encounter note letting us know about that. When we exported the refund, it created another encounter note. And in that encounter note is the address that was in play at the time, because sometimes on refunds, you may have alternate addresses or refund addresses defined. We support that on several different levels in Refund Manager. And then last, when we closed the loop, we brought back in the check number, check date, and check amount. So you have that available for you in NextGen. So that's the workflow of both tools. Unapplied is a rule builder. It runs overnight. It does the heavy lifting. You can run it interactively for testing. And then Refund Manager is more of an interactive tool that you'd give to a number of people in your back office to be able to research and decide what you're going to do with the money, if you're going to distribute it to other places where money's owed on that account, or if you're going to refund it, or if you're going to task it and just handle it later, because as you know, certain encounters become a mess after a while. I'm going to go ahead and turn it back to Tom.
Okay, thank you very much, Joe, for that demonstration of the two products. As far as next steps go, if you would like to have a more in-depth discussion about Refund Manager and/or the Unapplied Deposit Manager software, my contact information is up here on the screen, and Joe's contact information is up here on the screen. So get in contact with us, and we can schedule some time to go through a more in-depth discussion. This will give the opportunity to ask more questions as it pertains to your practice in your health center and to your current processes. And with that, if you have any questions, we'll go ahead and answer any questions that you have.
Okay, as a reminder, if you have questions, you can type them in the questions area of the webinar control panel, and we'll hang out as long as people are asking questions. If you don't have any questions, feel free to jump off. I did see an email come through from Tracy a minute ago, and absolutely, Tracy, I'd be happy to send you that stuff that you requested. So thank you for sending me an email, and I'll get you some information, further information, in a couple of days here. And thank you for joining us. Again, questions can be typed in the questions area of the webinar control panel. While we wait for questions, Joe, do you want to take a minute and tell people about how long the training process takes on these?
The training process is really straightforward for both these tools. For Refund Manager, because that's going to be used by more people, we provide an online video and a user guide, and we'll do a Q&A session with you where we'll walk through the whole process in your environment on your test system, and then we'll do that again on your production system. For the Unapplied and Deposit Manager, we'll set that up in your test environment. We'll sit down and talk to you about some of the rules you want to create. We'll kind of stub those out, and then we'll let you kind of go loose for a few days and try variations of those rules and be available for questions and, how do you do this? How do you fine tune that? So it's very much a hands-on experience. We want to make sure that at the end of the process, you're able to use either one or both of these tools with, great capability.
Okay, well, it doesn't look like we have any questions. So either we covered everything really thoroughly or people are going to wait to reach out to us independently. So really, any way you can get a hold of us, we're happy to help. I'll be sending out a link to the recording and slides within a few days here, so you can always reply back to that email, and I'll make sure that Tom and Joe get the question, and we'll get those answered. Any way you can get a hold of us, we're happy to help. That's why we're here. So thank you all for joining us today, and I hope you enjoy the rest of your day, and we'll be in touch.
Thank you, everyone.
Thank you very much, everyone.